So far, you would have understood what we are trying to do. So, let us go back to the patient A. This is patient A is having a kapha vataja vyadi. So, kapha is also shita and vata is also shita. So, ushna virya dravyas will reduce both vata and kapha. So, basically Vaipadika is ruksha vyadi. So, snigdha should be given. So, the treatment should be ushna snigdha both internally and externally. So, what are the ushna snigdha dravyas which are available for internal intake? We can give Indukanta Ghritam, which is Ushna and Snigdha. There is also Indukanta Ghritam capsules in different companies that are available, like Kerala Ayurveda. You can give that. We can choose Guggulu Tiktakam Ghritam. It is also an excellent option. Both Indukantam Ghritam and Guggulu Tiktakam Ghritam are Ushna, very good Ushna, and Snigdha. So we can also choose Panchanimbadi and Gandhaka Rasayanam, which is Kapha in nature. But only one problem with Panchanimbadi and Gandhaka Rasayanam is a little bit Ruksha. So we can add Snigdha Dravyas as Anupana or Saha Ushadis. Like for example, you can add Panchanimbadi, you can ask the patient to take Panchanimbadi Gulika or Panchanimbadi Churna along with the milk. Like that. So you can add it with the Snigdha Dravyas. So only one problem while giving Indukanta Ghritam, Guggulu Tiktakam Ghritam, if the patient is having little bit of pitta increased in his body, then this treatment will be definitely hell for him. So if you doubt there is any kind of mild pitta associated, always give along with the Indukanta Ghritam or Guggulu Tiktakam Ghritam, be prepared to give Avipatti Churnam along with it, so that the excess pitta will go out of the body. So for internal options, we have Indukanta Ghritam and Guggulu Tiktakam Ghritam, Panchanimbadi Guliga, Gandhaka Rasayanam, Avipatti Churnam, and a lot of other options. Basically, the treatment should be Ushna in nature, which reduces both Kapha and Vata. It should be Snigdha in nature. So, what is for external application? In Kapha Vata patient, there is an excellent external application called Rasottamadi Lepam. It contains Parda, Jiraka, Haridra, Krishna Jiraka, Gandhaka, Manashila, etc. and which is titurated in cow's ghee. So it is excellent Ushna Snigdha Dravyas. When applied externally, it cures Kapha Vataja cracked feet very nicely. So and another one option is Jatyadi Thailam or Jatyadi Ghritam, which is also excellent in reducing this cracked foot. So before the patient applies any form of ointment, you ask the patient to keep the leg in hot water, which is mix a little bit of salt along with the hot water. Keep the foot in that hot water for 5 minutes and then apply the ointment, because the foot becomes soft, and after that application of ointment gives good results. Hot water along with the salt itself is Ushna and Snigdha, so it should be definitely Kapha Vata Hara. And Rasottamadi Lepam or Jatyadi Thailam is an excellent choice for external application in Kapha Vataja patients. Now, when coming to Pitta Vata Lakshanas, there are Lakshanas of burning sensation, itching, exfoliation of the skin, that is, skin is coming out in layers, and there is bleeding in the cracked foot and the pain in the cracked area. And the patient comes from a hot area like Chennai. So while treating this Pitta Vata cases, we have to grossly categorize patients into two categories. One is patients having all the symptoms, whether they belong to Nirama stage or Ama stage. How to identify Ama in the patients? So now we are first step is you are finding the Vaipadika, next step is finding the dosha, and third step is finding whether Ama is not associated with it. So how to identify Ama? As a classical Lakshanas goes, Shrotarodha, Blabramsha, Graura, Anila Modata, Nishtiva, Malasanga, Aruchi, etc. All those Lakshanas are there, but practically how to identify Ama? Ask the patient to show his tongue if it is coated or it is pinkish. Find that. Ask them about their digestion. Many people lie about their digestion, that he is hungry, he is having time at proper food, having proper timely food, etc. But ask them if they are too much tired after having food. They are feeling like they have to lie down at the end of having every meal, breakfast, lunch and dinner. After having food, they feel like sleeping. That indicates a classic presence of Ama. Ask if their bowel movements are irregular, if they are constipated eventually, or they have frequent bowels, like immediately after food they have to go to toilet, etc. So all these Lakshanas indicate the presence of Ama in the body. So for Pitta Vata patients, you have to first identify whether he is Ama
having ama lakshanas or nirama lakshanas. If he is not having any of these ama lakshanas, then the aushadhi that we can choose can be guru. We can choose like Mahatiktakam Kashayam. It contains 50% of Amlaki. It is a rasayana and is a little guru to digest. We can choose Mahatiktakam Kashayam. We can choose Saribadi Asavam, Kamadugan with Mautika, Kamadugaras with Mautika. Because Mahatiktakam Saribadi Asavam, the combination of Mahatiktakam Kashayam and Saribadi Asavam is very popular among our side of treatment. So this gives beautiful result in the cracked food. If they are having ama lakshanas, then you should go for deepana pachana dravyas. In pitta, you do not, in kaphavata, while giving treatment for kaphavata, you do not have to worry much about ama, because all the dravyas which we give in kaphavata will be little bit ama pachana because they are little ushna. But when it comes to pitta, when the patient is having ama, there are very little drugs to choose, because in paitika ama you have to give tikta pachana. You have to give tikta pachana dravyas like Gulichadi Kashayam and Vasa Gulichadi Kashayam, Kaishara Gugulu, and you can choose Arishtas like Nimbamritasam, which is doing Tikta Pachana and it is Pittara as well. And you can add Avipati Churnam to clear the ama, to remove the Malasanga, etc. And for external application, you can choose Shatatauta Krita for external application, or Yamaka Sneha, or Eshtimadu Taila, etc. You can choose of the Pittahara Dravyas which are Shita Snigdha in nature, and anything you can give it for external application. So the important thing here is to identify whether it is the patient is having ama or in Nirama stage. If they are having ama, you have to give Tikta Pachana Dravyas like Gulichadi Kashayam, Vasa Gulichadi Kashayam, and Arishta you can choose Nimbamritasam and Churnam, Avipati Churnam, etc. But when the patient is having and is not having ama, you can choose Guru Dravyas like Mahatikta Kashayam, Saribadi Asam, Ushira Asavach, Chandana Asavach, Kaishara Gulu, and external application can be Shatatauta Grita or Emaka Sneha or any of the Pittahara Dravyas like Eshtimadu Taila, etc.